This launch during this workshop is not an end in itself. We hope that the outcomes will be actionable to give the campaign a shape that will enable it to achieve its objectives. We must collaborate to change some of the existing realities as it relates to wash access in our country. Among these are the fact that 167 million Nigerians lack access to hand washing facilities with soap, that only about 55% of healthcare facilities have basic water supply services, and 17% of hospitals do not have any water services at all, that only 1 in 3 healthcare facilities have hand washing stations with soap at points of care, that only 1 in 4 have hand hygiene stations with soap and water in toilets, and only 1 in 10 healthcare facilities have basic sanitation services, and that 1 in 4 healthcare facilities do not have toilets or latrines on premises at all. Furthermore, only 15% of healthcare facilities have improved toilets which are separated for females and allow for menstrual hygiene management. 1 in 5 healthcare facilities have improved toilets which are accessible to those with limited mobility, and only 28% of health care facilities with wash facilities kept a dedicated budget for cleaning and maintaining these wash facilities. This situation exists in spite of the existence of a technical guide for wash in primary healthcare facilities developed by the National Primary Healthcare Development Agency since 2016, and the adoption of the quality of care that is inclusive of wash in healthcare facilities. There is also an ongoing collaboration between the Federal Ministries of Health and Water Resources to include wash and the country's universal health coverage objectives, in line with the World Health Assembly Resolution 72.2. The absence or lack of adequate wash services in healthcare facilities can compromise patient safety. It can exacerbate infection spread, increase risks of hospital-acquired infections affecting staff, caregivers, and vulnerable patients, higher healthcare costs for patients, as well as undermine efforts to improve child and maternal health. It therefore means that policies and frameworks must be backed by action for change to occur. These are some of the changes that this campaign hopes to achieve to ensure that we'll build back better and can face future pandemics with greater courage. That never again will Ebola, COVID-19, or cholera kill our people, or trachoma cause our children to go blind. Scientists predict that with climate change upon us, the next pandemic is not a matter of if, but when. As I thank you for honoring our invitation, may I request that in addition to active participation, we take the next steps from the event away to our various agencies and organizations and put our weight behind proper planning, concrete action, adequate funding, effective spending, and efficient coordination. We must take collective action until our citizens, especially the poor and vulnerable, can take the availability of water and wash facilities in healthcare centers for granted and can access water to wash their hands regularly and at critical times, both in their homes and in public places. I therefore call on the support and collaboration of stakeholders, ministries of water resources, education, health, environment, relevant departments and agencies, and the private sector to prioritize WASH through improved coordination, financing, development, and implementation of sustainable programs targeted at improving water sanitation and hygiene access for all.